Hi, I'm Megan, and I'm going to be discussing potential technology solutions for cystic fibrosis patients. So, first, some background. Cystic fibrosis, or CF, is a genetic condition causing mucus buildup in the lungs, which makes it hard to clear, so infections occur very easily and also causes lung damage. Patients with CF require self care and they must attend specialized clinics. Recently, there has been interest in monitoring devices and applications for long term care. This technology will put the chronic care cycle into play in a collaborative system where patients in the home setting will interact with clinicians in a clinic setting. So overall, with the incoming of all this new tech, sharing this data will between all the parties, like whether it's the patient or the clinic team, is highly essential. There are high expectations from both sides, and there will be barriers if not everyone is on the same page while they're communicating information. What is needed is a collaborative interpretation. So, for the current care structure in place today, there are MDT or multidisciplinary teams at specialized CF centers. Patients must be very self managed and attend the clinics frequently. So, some new solutions include telehealth, which is like video conferences, or home monitoring devices for real time data, or even an iPhone app called My CF app, which is a clinic link management app which provides tools as well as community. I found this article very interesting and even realized even more so after the hackathon that tech solutions can really be applied to other healthcare situations like CF or opioid addicts. It makes me wonder what else we can apply this technology to, even though there are some barriers regarding like relaying information, but I feel like it can be done.
Hi, this is Marina, and I'll be discussing the treatment methods of cystic fibrosis. Unfortunately, there is no cure for cystic fibrosis, but treatment can ease symptoms and reduce complications. Close monitoring and early aggressive intervention is recommended. Managing cystic fibrosis is complex, so consider obtaining treatment at a center staffed by doctor and other staff trained in cystic fibrosis. Doctors may work with a multidisciplinary team of doctors and medical professionals trained in cystic fibrosis to evaluate and treat any condition. The goals of treating cystic fibrosis include preventing and controlling infections that occur in the lungs, removing and loosening mucus from the lungs, treating and preventing intestinal blockage, and providing sufficient nutrition. Medication options for cystic fibrosis may include the following: antibiotics to treat and prevent lung infections, anti-inflammatory medications to lessen swelling in the airways of the lungs, mucus thinning drugs that can help you cough up mucus, which will improve the lungs' function, inhaled medications called bronchodilators that can help keep your airways open by relaxing the muscles around the bronchial tubes, and oral pancreatic enzymes to help your digestive tract absorb nutrients. You can manage your condition and minimize complications in several ways. First, by paying attention to nutrition and fluid intake. A healthy diet is important to maintain good lungs function. It's also important to drink lots of fluids, which can help thin the mucus in the lungs. Second, keep immunizations up to date. People with cystic fibrosis should have the annual flu vaccine that they should keep track of. As with cystic fibrosis, people are more likely to develop complications when they become sick. Next, exercise. Regular exercise helps loosen mucus in the airways and strengthen the heart, which will improve the lungs' function. Also, it's really important to eliminate smoke. Not just by not smoking, but also don't allow other people around you to smoke, as smoking is so harmful for people with cystic fibrosis. And lastly, encourage hand washing, as hand washing is the best way to protect against any infection.
Hello, I'm Victoria and I'll be talking about how patient experience is changing as providers embrace telehealth. While there are still many patients who prefer face-to-face visits, healthcare organizations are trying to change that. They have slowly begun shifting to virtual care options, as the reality is that there are staffing challenges and value-based care has become more apparent. However, there are several barriers that organizations must face before patients fully accept the transition to virtual care. There are many patients that lack access to devices with cameras for the video meetings, and some do not fully trust the security and safety of virtual care. With the lack of confidence and concerns of virtual care quality and safety, many patients have not fully accepted virtual care as an option. Despite these concerns, there have been upward trends of patients slowly becoming more accepting of such technology. It can be seen that telehealth acceptance is driven by the need to expand access to healthcare. It makes it more convenient and easy for people to access healthcare. It can better monitor and treat the at-risk population and expand healthcare programs.
Both articles I seem to look at the importance of at-home care for various conditions. This is so as to make easier for the patient who may have critical conditions and find it hard to go to a hospital. It also saves a lot of time on both ends. One way at-home care is being implemented is through Telecare. Telecare is a remote way of checking how a patient is doing. Some ways that may check is through a fitness tracker, video calls, or even just through websites by inputting data. It is definitely an easy way to check for a patient, but there are some hesitations stated in both articles. For example, Telecare only works for people who have technology, so the lack of access can be a bit of a problem, as well as the patient's lack of confidence to share their private information through technology. It's a worry of privacy and security, as well as a lack of knowledge on how to navigate through technology, which could be a bit more difficult for the older generations. Though this is the way of the future, and I think it's great to be implementing Telecare.
Hi, my name is Eric, and I'm going to be giving an overview of what my group talked about. So this week focused on cystic fibrosis and telecare. And like they mentioned, cystic fibrosis is a fatal genetic condition causing patients to struggle from clearest mucus in the lungs, and it can often lead to infection and severe lung damage. So as you can probably see, like the life expectancy of patients who have this condition is very low. And patients, for them to be better, there's two primary factors, daily care and regular checkups. And because there is no permanent solution to this treatment, we look for other ways to provide those requirements, which is telecare. Telecare can, improve contact with patient and clinicians. It can provide apps that helps with exercise, giving them proper care virtually, provides them with more knowledge of cystic fibrosis and their condition. And it could also help them track their food intake and their fluid intake, which are all important for, patients with cystic fibrosis. So with telecare, it's not the most perfect thing. It's still continuing to improve. But it's up to our generation to, create and to use our education and the advancements we have in technology, to better patients of not only who have the condition of cystic fibrosis, but other conditions as well.